Single nucleotide polymorphisms is a way of saying you have a normal gene, but this gene is known to come in different flavors. There's vanilla, chocolate, strawberry, and you have the strawberry flavor, okay? If a third of the population needs methylated B12 and methylated folate, where was that coming from before the supplement industry came about?
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have an expert in one of the most important topics, if not the most important topic. We have Dr. Stasha Gominak with us. She is the creator of RightSleep. And after closing her neurology practice of 30 years, she decided to change professions and do what she loves most, which is help people sleep better. So RightSleep is a unique program that grew out of watching her neurology patients improve slowly just by sleeping better. They had fewer headaches, less pains, fewer seizures, less anxiety, and more motivation. So Dr. Stasha, thank you so much for joining us today.
Well, thank you so much for asking me. It's my pleasure to be here.
Yeah, well, would love to just start with a brief background of your history of why you decided to move into this work that you're doing today.
My journey through sleep started with one of my headache patients, and unfortunately, daily headache and severe migraine is a very common problem, and we as neurologists have not fixed it. We have all this knowledge in genetics, and there's still millions and billions of people suffering from headaches. And one of my headache patients who I had treated with all the recommended preventative medicines, et cetera, who had not succeeded with any of those. And I'd been practicing for 20 years before that and had very mixed success with the recommended treatments. One of them said, I want to have a sleep study. And she was young and healthy. She exercised regularly. She did all the right things, but she's turned out to have sleep apnea. And nowadays, that would not be surprising. But this was 20 years ago when young, healthy females were never considered to possibly have sleep apnea. So that by itself would not be important. But she put on a CPAP device, and in about 3 to 4 weeks, her headaches got better, and then they went away. And that to me was mind-boggling because I am biochemically based. I love biochemistry. I think of things happening chemically in the brain, and I couldn't quite figure how it was that putting this horrible torture device on at night could make her headaches better. So she did not have drops in oxygen, and that's what had been proposed in many other of the other practitioners. And in fact, it's important to remember that we're all making up what we think is the reason why things happen. We did not make this thing. Medicine is expected to be able to give as good an explanation as the maker of a refrigerator. Man made that refrigerator. We have all these steps. So we make up these explanations. She didn't have drops in oxygen. And the only thing I could think of was, well, clearly these times when she would stop breathing were breaking up blocks of her deeper repairing sleep. So the first realization is, one, wow, if all of my headache patients have a sleep disorder, I have not been looking for that. And let's see what their sleep studies look like. That led to about 4 years of thousands of sleep studies, first with mostly young, healthy females with headaches, and then basically everyone who came to the neurologist, and they all had sleep disorders. They didn't all have sleep apnea, which was frustrating because the CPAP device and sleeping pills was really all we had. That's all we had. Very frustrating for me as the clinician. We're told we're not supposed to give sleeping pills. And once I saw people sleep better and then have fewer headaches, then I started to give a lot of sleeping pills. But sleeping pills are not the answer. That's why we're discouraged from them. The answer really is, why aren't they sleeping normally? And that answer, why aren't we sleeping, has not so far, at least at that point, been viewed as the brain is lacking something it needs. One of the basic tools, one of the building blocks it needs to actually complete sleep. In the case of the headache patients, most of them had had a baby, 2 babies, 3 babies. Their sleep had been fine before. There's an idea that if someone is already on drugs, that maybe it's affecting it. But these women were not on medications, and they're doing everything we've told them to do. That means we have a sleep study that shows, gee, she doesn't have any rapid eye movement sleep, a specific phase of sleep. Mm-hmm. And over time, it became clear that this population, who shouldn't have anything wrong with their sleep, had a really important lack of rapid eye movement sleep. And then the next question was, why? And why aren't they reporting that on the report? Because as soon as the patient, say, well, great, I knew there was something wrong with me. Since my second baby, I wake up at 3 a.m. and I can't go back to sleep again. And then I say, well, yes, you have no REM sleep, but I don't have a clue why, and I don't know what to do. We feel embarrassed, and so it's not on the report. And that piece then began a long journey of searching for what could be wrong, because there's something chemically wrong. It's not a genetic problem. Their sleep was normal before. Maybe it's epigenetic, which would be really interesting, because then we might be able to play with that. So I'll let you ask any questions you have.
Yeah. So I guess people are, first of all, it's fascinating. And then certain deficiencies you mentioned, and I know I've heard you also mention gut microbiome. And this is really interesting because, you hear the generic sleep advice, like, okay, sleep in a dark room and, don't eat for a couple hours before you go to bed and stuff like that. But you don't hear too many people talking about the microbiome or deficiencies in certain vitamins or minerals. So yeah, I would love to hear a little bit more about what you found there.
That's a really important point. It's not that what is called CBTI, which is cognitive behavioral therapy for insomnia, which means we teach you the right way to sleep. My patients are not stupid. They have already tried those things, and also what I realized, especially with this particular population I started with, if they have 2 little kids, they aren't going to come to the doctor and say, I can't sleep through the night. Because what is everyone else answering? Well, you have 2 little kids. You have an infant and you have a 3-year-old. What do you expect? Well, if we were really designed to have 15 babies, which I've had some clients who have had 15 babies, that means you better have been able to sleep in between. Otherwise, you would have gone completely insane and you'd be dead, which is actually what happens to some women after, their 4th baby. So there are actual things that are associated with developing this lack of REM sleep. And it turns out that there's a neurotransmitter called acetylcholine that runs the parasympathetic nervous system. And it turns out at 3 a.m., we switch from more sympathetic tone to more parasympathetic tone. And parasympathetic tone, or an increase in that side of the autonomic nervous system, which is run by acetylcholine, happens then. And if you do not have enough acetylcholine, you cannot complete that phase of sleep. Now, I didn't know any of that stuff. I came into this completely naive, just frustrated that I was reading all the articles. It is very frustrating still that I go to the sleep meetings and I hear animal models showing that acetylcholine really governs the ability to do REM sleep, but there's nothing about humans that are acetylcholine deficient. And so I got into this field by accident. I fell into the fact that we did vitamin D levels after one of my patients had a profound B12 deficiency. She was a beautiful 18-year-old. She had absolutely no deep sleep. No slow wave sleep, no REM sleep. She woke up 35 times an hour. She was about to go to college. She was really tired. She came to see me for headaches. And I looked at her sleep study and said, this is a disaster. She has no deep sleep of any kind and no answer for why. She did not stop breathing. She did not have an airway problem. She turned out to have a profound B12 deficiency. With that, and the fact that there is already literature about how B12 has to do with being able to complete sleep stages. But if you read in the neurology textbook about what to do for the person who has headaches, it does not say check a B12 and treat their sleep. So if you enter it from what does B12 deficiency look like, which is what happened when I Googled, oh, what about B12? Could that be? It says chronic fatigue and daily headache. But depending on how you put the search terms in, also, doctors, including me, have been so aggressively led away from vitamins. So anything that has the vitamin word attached, if I'm trying to talk to a colleague, even one that's known me my whole career, they have the eye roll comes immediately as the word vitamin comes out of my mouth. So B12 shots, and then it turns out the shots really don't work. They shouldn't be once a month. It should be every day. B12 daily changed my clients' sleep immediately. They would come back and say, I have 2 good nights. And you're nodding because your story is about inflammation. B12 is part of that story, without a doubt. So the person comes back and said, I got my B12 shot. I had 2 good nights and 28 bad ones. And so then I look into the literature, and it turns out if you give 1,000 micrograms of B12, you can get the B12 level up again. So there are many dogmatic statements and things that have resulted from habit regarding vitamins that haven't been critically reviewed. But if you listen to the patient, you will learn amazing things, okay? If you are the patient, then you learn amazing things. And your mind is open because you were desperate, and none of your practitioners will do anything, and the things they offer you don't work. So we were all desperate. My patients are desperate. The ones that are doing better have shown me that we could get their medical problems to go away, that all medical problems are basically a lack of the normal function of the repair systems of the body, and that we do that repair in very specific phases of sleep. As you can tell, I get quite impassioned about this. So B12 is the first vitamin, and it works. And then somebody mentions D to me. Actually, the gal who mentioned it was a sleep medicine physician who was on disability because she was so ill. And she knows all the things that she's supposed to do, and they haven't worked. And she aches all over, much like your story. And she says, my doctor did my vitamin D. It was low. She gave me vitamin D, and my wrist pain went away. And I thought, there's a big blank here because I'm totally naive, all right? But if her wrist pain goes away, and I'm thinking, well, maybe it'll affect what she does with her body in paralysis and sleep, because this is the second piece that nobody's talking about. If you get perfectly paralyzed, you sleep through the night, your limbs get paralyzed and they repair. If you do not get perfectly paralyzed, then you stop breathing because your throat and your neck and your bulbar tongue and all the inside of your mouth gets too paralyzed. You develop sleep apnea, okay? Not to say that there isn't an anatomic issue as well, okay? So both have to be addressed. But once you have a perfect anatomy, the brainstem is paralyzing all of these muscles so they can be repaired while you're sleeping. That's an amazing engineering feat. Because she told me this, I just added a B12. I had never done any sort of vitamin levels for sure in my patients who had either chronic pain or headaches, and everybody's D was low. And I was measuring it from August to December. So everybody's D is low. That's not, now again, we're 15 years later from that. Everybody knows about vitamin D now. There's a huge, huge debate going on in medicine with very argumentative presentations on both sides. But in actual fact, it's a chemical that we all need. It's a basic biologic hormone that every single animal on this planet, all the way back to insects, every animal uses it for various things. It really shouldn't be treated like an emotional piece. It should be treated as it's something that we need to learn about. So I know nothing about vitamin D. I have all these D levels that are low. And then 2 guys come in at the end of the 4th month and say, and these are 2 guys in 1 week that are very similar in that they're both using CPAP. And the first guy says, I've been using my CPAP for a year because you promised me my headaches would go away. And they did not. And I go, bummer, I'm sorry. And he says, no, I have more to tell you. That note you sent me, because you did my vitamin D last time, you made me go get a vitamin D level, and then you told me to take some vitamin D. And in about 3 weeks, I started to sleep better, and my headaches went away. So there are very important points there. One, I started to sleep better, And then my headaches went away. Okay. And the second guy tells me the same story. Now, these two men were on CPAP, which helps. There's no question that it helps in someone with apnea. But they also turned out to have D levels that were a little higher than all those women who had babies. And therefore, they had a clinical response that they could tell me about with a really tiny dose of D, because what I recommended at the time was 1,000 IUs, which is what the FDA recommended at the time. So I go to the literature, and this is one of the frustrating parts for me, is the literature about vitamins is similarly should have like a skull and crossbones on the top. Like, doctors shouldn't read this. It's too scary. It's too woo-woo. Sorry, this is the basic building block of every piece of biology there is. So vitamin D has an article in the early 80s from a guy named Walter Stumpf, who shows there are vitamin D receptors in the nucleus that paralyzes us during sleep. That's written in 1982. That is referred to in a textbook of neurobiology, a fabulous textbook that in year 2000, one of the older editions, one of the two authors, and I think it was Jerry Siegel. I haven't really gotten to, but I'm pretty sure it's Jerry Siegel, who is a brilliant sleep researcher, mentions that, this nucleus right here in the brainstem, if it weren't working correctly, if it were malfunctioning, could cause sleep apnea and periodic limb movements of sleep or inappropriate movements in sleep. So I'm not the only person thinking this. It's already been in the literature now for 25 years. And for the first time, I think every single one of these people has a low D. And oh, by the way, has Walter Stumpf already put together a belief system? Because it's really important to understand that every view, you learned this, Talor, when you went through what you went through. It is your belief system that either gives you the blinders not to see other things or organizes your brain so that you're able to see things that might help. We always see literature through a belief system. So Walter Stumpf put together a very good belief system, which was vitamin D, which is made by the sun on our skin, only during the summer months as you move away from the equator, makes us able to hibernate in the winter. All of Canada needs to be able to deal with no food in the winter. Well, do we think of it that way anymore? No, because we go to the grocery store. But all animals that live outside have two choices. They can hibernate or they can migrate. Well, I just saw the Canadian geese flying over my house. Why do they go to the equator for the summer? Because they can still make vitamin D there. So there are aspects to this particular chemical that will run their desire to migrate. And with mammals, we can't move that fast, or in the past, we couldn't move that fast. And we had to lower our metabolic rate because we didn't have as much food. We had to sleep longer. We have beautiful descriptions of this in bears. We have interesting articles that follow the bears around and collect their poop during the summer and before they actually get into their den, documenting that over the spring, summer, fall, the actual makeup of the bacteria of their microbiome changes. And we don't make fun of a fat bear who is trying to gain weight in the fall to make it through the summer. Instead, we make fun of fat people. In fact, we know that their microbiome makeup is what makes the calories that we eat be put into fat, because that is what allowed us to eat what was available, but put it more into fat, to store it. So in the summer, we put our calories into muscle and building. In the winter, we put it into fat to store it to get through the winter. That means if I don't adjust your microbiome, when I force you to lose 100 pounds, you will not do well. There are ways that you can make this happen, make the weight loss happen, that have to pay attention to leptin, ghrelin, and the input of the microbiome. So to make this a little bit shorter, I used vitamin D. I talked to Walter Stump on the phone. He and I did a clinical trial using his scientific evidence that was extensive and amazing, and my clinical response of my patients. Over a 2-year period, we showed that if you get your D to over 60, in the Canadian units, it's over 150, then they would just come in and say, my sleep's better. And I would go, whoa, last time your sleep was terrible and you were taking the vitamin D. What happened? He said, I'm still taking it. And I'd go, okay, let's send you down and get another level. It's not like I knew what was going to happen. I'm not a scientist. I'm trying to help my patients. I'm in regular old private practice, and I send them down to the lab, and it turns out breaks over 60, they start to say their sleep is better. And there is evidence that usually our normal physiology is to not be able to run it over 80, okay? That's still a little bit not clear to me because it's very difficult to actually document that scientifically. But my website suggests that 60 to 80 is the place where you will have better sleep if you have a sleep disorder. So Walter and I put together more than 1,000 patients and published that in 2012. And here's the most important piece of information you're going to hear from me today. In 2013, we all fell apart and all the pain came back. I didn't have pain to start with. All I had was not feeling very rested and many wake-ups. But most of my patients who'd been with me for 2 years doing the D came back with new pain complaints. This is why I have a website. Your journey is about that pain and many, many different types with different mechanisms. We all started to fail, and I was desperate. I didn't know what was going on. I was failing at the same time. I had this peculiar buttock pain. I couldn't sit down at the end of the day. I was too timid to go to my doctor and say, take an MRI of my butt, because they already think that, I'm saying the vitamin word too much anyway. And a patient brought me a book about pantothenic acid. Pantothenic acid is one of the 8 B vitamins. It is completely ignored, completely overlooked since about the 1980s. It was not overlooked in the 50s, 60s, and 70s. In fact, it was used in a lot of clinical trials for autoimmune disease because it was found that it is a major piece of what is called coenzyme A, and coenzyme A is necessary to make cortisol. And in the 60s and 70s, we were realizing that prednisone that fakes out and acts like cortisol, so it's a substitute cortisol, makes inflammation go away. And it treated rheumatoid arthritis. Prednisone was the first successful chemical to treat arthritis and generalized pain. And it's an anti-inflammatory. That means the body has its own internal anti-inflammatory systems. So this was B5 was being used in clinical trials. So she brings me this book, and as usual, I'm very skeptical because it says vitamin, and I read it, and it says not only does their pain go away when you give B5, 400 milligrams, the specific dose in this book written in the 1990s. You give 400 milligrams, their pain goes away, and they sleep better. And it has references that are the descriptors behind why, perhaps scientifically, the sleep gets better, okay? So I go to those references. The references are this creepy lab that's next to the Iowa State Prison who make some of the convicts B5 deficient by using a blocker. And within 2 weeks, they took them from no complaints to insomnia, belly complaints, a funny gait like Pinocchio or a puppet-like gait, and joint pain and burning in the hands and feet. I had 2 patients who had been with me for 2 years taking the vitamin D who had come in the 2 months before reading that article that had burning in their hands and feet. And I am a neurologist. My subspecialty is neuropathy. I had been practicing for 25 years already by that time, and burning in the hands and feet is extremely unusual. I'd had one patient back in California who came in putting 32 young guy, putting his feet in ice water. His feet were purple and he had horrible burning in his hands and feet. These two girls walked in with that complaint. They did not have diabetes. We've always blamed it on diabetes, but in fact, curing the diabetes does not actually take the burning away. B12 is a player in that, but it's not the most important one. So if you treat with the B12 only, usually it works for a while and then it wears off, which usually means you've given some of what the brain needs, but not all. So as soon as I read this burning in the hands and feet, I'm like, whoa, inflammation, we've got cortisol, we've got coenzyme A. This explains a lot. And I start my patients, only the ones that have now pain complaints they didn't have before, that have been with me for 2 years taking D, who have a good D level of 65, which also was my state at the time. And we all start on 400 milligrams of pantothenic acid and B100, which is a large dose B complex, okay? When I went to the vitamin store to buy this for myself, I'm standing in front of the B complex aisle, and this particular store had about 10 different suppliers and 10 different methods that were all called B complex. And when you pick those up, they might have 3 Bs and a C, or they might have 4 Bs. There is no consistency. And what I recalled from medical school was if you give 1 B, you should give all of them, that they are very intertwined. And again, I'm very naive. I have no vitamin training since college. And then I was brainwashed out of the whole vitamin idea. So I give B100 and all of us go home. I went home, started on this preparation of 500 milligrams of B5. It did not affect my sleep, but it made my restless leg syndrome, which is my sleep disorder, which is why I'm so empathetic about this problem, get horribly worse by about the 4th day. So before I realized that the dose was too big, I had given this recommendation out. I do not give out my vitamins. I think that that's my message is different. I have no objection to anyone recommending vitamins. I understand that that is your job. My job is to try to educate. So I give out recommendations. My patients come back. The 2 gals with the burning, gone in 2 days. Dramatic. But the other people who had been with me and had D levels that were different than the ones in the book. Remember, this book is published about people with rheumatoid arthritis. And I can tell you that rheumatoid arthritis actually results from the D going low, losing the microbiome, and then the inflammation. So I didn't know any of that at the time, but my patients come back and say, oh, I'll tell you what happened to me. So by the end of the 5 days and I'm on 500 milligrams of pantothenic acid, I realized my restless leg starts in the morning and it's all day long now. It had been completely controlled before that. So I stopped the 400 milligrams of pantothenic acid and I think this is the same thing as with D. There's all this incorrect information. Why is this bottle sitting on the shelf? This is the only strength of pantothenic acid you can get at the health food store. Why is it making me worse? What's different about me? My patients start to trickle back in, and then some of them bring in the 400 milligrams and say, were you trying to kill me? I got so agitated. I couldn't sleep at all. There is a dose effect of this particular vitamin that is very, very palpable to anyone who takes it. The people who need 400 milligrams feel great. The people who don't need 400 milligrams feel awful. The thing to take from that is a chemical, no matter which one it is, if it's B12, B5, D, that plays a role in the chemistry of creating sleep, is powerful in sleep. That means if it's right, you're going to get great sleep. If it's wrong, if it's too high, it's going to destroy your sleep. This is not the way we've been taught about vitamins. So there were many things that happened to me and my patients along the way. And what happened to me was I stopped the 400 milligrams. I stayed on B100. And in 2 days, my butt pain went away. And my restless legs was back to being easily controlled. And several of the patients, after saying, "Were you trying to kill me?" said, "I stopped this 400 milligrams and I stayed on the B100 and my pain went away in 2 days." And I was like, wow, that's what happened to me. What do you think? What do you think is going on? Because I had pantothenic acid articles were non-existent. There's a whole story in neurology of genetic issues that is really interesting, but it's also quite long. So at the time, all that they say is pantothenic acid deficiency doesn't exist because it's in every food. Well, I'm sorry, this stuff can't be in the food. Otherwise, you and I would eat the wrong thing and we wouldn't be able to sleep. This is extremely powerful in sleep. The second question is, I just did D with all of these patients. That's what's different about them. Is it possible that there's a synergistic effect between the D that I've been giving him for 2 years and the effect of this? We know that it makes cortisol, but frankly, I don't think cortisol is what's doing this. They're being awake or not, like overnight, this is acting like a drug. And in actual fact, it is acting like a neurotransmitter. This is where I live as a neurologist. I give out drugs that either mimic or change levels of neurotransmitters. I take an antidepressant. That antidepressant increases norepinephrine and serotonin. I'm used to those, and I'm used to learning about the neurotransmitters actually through the drugs I use. And that's important because within the next 2 years, I'm struggling to understand what's different, but there aren't any articles written about acetylcholine in sleep in humans, even though the veterinary literature says acetylcholine is important for alertness during the day and REM sleep at night. I found that on Google in the veterinary literature. So
I
wanted
to ask you about acetylcholine. I heard you mention that earlier. And then also just to kind of recap for people on the vitamin D, looking for the ideal range between 60 and 80, especially if you have sleep issues. Most people aren't getting up that high, right? And I think when you're doing a normal lab test, I think the normal range is like 20 to 60 or something, something like that. I could be off, but
30 to 100.
30, yeah. So it's very low. You could be at 30, 35, 40 and still be considered in a normal range.
Yes.
And that's why so many people have to supplement with vitamin D to get those levels up. And I personally think I agree with you 100%. I've always said if I could only take one supplement, it'd probably be vitamin D, and I take 5,000 IU, practically every day, unless I'm out in the sun all day or something like that. So yeah, that's a good one. And then vitamin B12. So that is also pretty common on probably not your general yearly checkup with your doctor. I wonder if they check B12 on that one. I know most of these websites, that you can get blood tests on, or if you go to a practitioner who, looks for this kind of stuff, they'll obviously test for B12. Do they test for the other B vitamins? I've done really extensive blood tests. I've had 28 vials of blood pulled at one time because I want to test every marker known to man. And I can't remember if I actually saw other B vitamins other than B12 that were actually tested there. So I'm curious to hear your opinion on that.
Okay.
But then also acetylcholine, because you've mentioned it a few times, is that also just which supplement then with regarding acetylcholine, or which foods, or how do people who are listening who say, how do I know if, and again, I've never seen acetylcholine on a blood test either. So how do I even know if I'm deficient?
No,
right?
You can't check the level. You can't check the level and you can't buy it. Okay. So your questions are a perfect introduction to this. The reason why I told you that I learned about neurotransmitters by the drugs I use is we have no duplicates for acetylcholine. There are no drugs for acetylcholine. In fact, there is one, and it's called nicotine. Oddly enough, nicotine is something that people who can't pay attention frequently get addicted to. And the people who use nicotine find that they can get up in the middle of the night, smoke a cigarette, and go back to bed. Those of us who are not acetylcholine deficient, if we smoke a cigarette and we inhale it, we get really jittery and we throw up. That means it is a measure of where your acetylcholine brain level is at that moment, okay? So there are several places within the health and wellness literature that talk about things like meditation or breathing that are things that increase your parasympathetic tone. And what they're doing is they're dialing up the acetylcholine neurotransmitter. The problem is if your juice has all run out and you aren't making any acetylcholine, you can meditate as much as you want and it will not produce that feeling of calmness. So the sympathetic side is called fight, flight, and everybody knows about that. We also have a huge literature that shows that you do heart rate variability studies in any disease, postpartum depression, diabetes, PTSD, you'll find that they're in sympathetic overdrive. What if I just stumbled by accident into the fact that when you don't have a good D and you don't have the right B vitamins, you can't make coenzyme A and therefore you can't make acetylcholine. So we are actually making people acetylcholine deficient by lowering their D. Now, here's the piece that's most important. It turns out that giving back D, if it were the only deficiency, if Walter Stump's original literature was correct, that the GI tract has D receptors all over the place, I thought when you give D, the microbiome should just come back and be normal. But there was something really important that happened. None of my IBS patients were that much better after 2 years of D. They still had a lot of IBS symptoms. I don't think poop samples are the way to actually look at the bowels, and we can talk about that later if you're interested. But what I had just stumbled into was this B100 that I'm taking. The first question is, why do I have to take 8? Why are there 8 Bs? You've been in this for a while. Why is there 8 Bs, C, D, E? It doesn't make any, wait, where did this idea that these are 8 connected chemicals? Because they are all made by the bacteria that live in our microbiome. That means what I've done, what have I done to these patients that have developed an obvious B vitamin deficiency? I have taken them from a D deficiency to a B vitamin deficiency. And they're all eating well. They haven't changed their diet. That means the Bs are not from the food. That is a misinterpretation of some of the experimental literature that was actually done in the 30s, 40s, and 50s. It turns out if you have a purely carbohydrate diet, the way we would look at that now is purely carbohydrate diet does not support a normal, healthy microbiome. Then when you don't have a healthy microbiome, you become B vitamin deficient. That's what was actually demonstrated with beriberi and pellagra, that one was all cornmeal, one was all polished rice. Those diseases were, in fact, the beginning of clinical description of B vitamin deficiencies. The piece that was missing in the background is D and the Bs in large doses and all together. So B100, or actually B50 is what I'm using now. B50 and D together for 3 months will bring back the normal, healthy microbiome. That has been consistently the case since about 2014, so it's now 10 years in my clients. That piece is just the first step. What you probably learned as you went into this was, even if you get back a normal microbiome, the 20 years you spent without the normal microbiome has then kept you from building the stores of iron, of selenium, of iodine, of the Bs. We have stores of all of the B vitamins. I'm saying that as an overarching idea. None of the measurements, except for B12, of the B vitamins are the least bit relevant to what my patients are experiencing. My experience has been, you can do that. In fact, there are really good scientific articles that already did these studies back in the 70s and 80s, giving certain doses of B5, showing that the urinary excretion will give you information, but that the blood levels are not relevant to what's happening in the brain. And I'm interested in the sleep and the brain. That is what I'm really interested in. That means none of these B vitamin levels are really helpful. The clinical history, that's the other thing that you have made a point of. The story is really where the whole information comes that tells you how long you've not had the right microbiome. And then once you get the right microbiome back, you're stepping into day one of having that organ of your body back. And it will then help you replete your stores. But that may take you 2 or 3 or 4 years. I now have people who say things like, in fact, these are my patients. This is the story of what happens after you finish RightSleep. I've been doing D and I did everything that you've told me to do. And now I'm 3 years out, and I would have patients who'd come back and say, my D is perfect. My headaches are gone. My sleep is good. My hair's falling out. And it turns out it's a sulfur deficiency. And sulfur is not in any of the multivitamins because it probably makes people who reach for them have sulfur smelling farts, and then they won't buy that vitamin. So there are aspects there are many of the minerals that are pivotal parts of every one of these biochemical steps. And the bugs have always been playing a role in making those. It turns out that we now have articles that show that there are certain metabolites that we've just named. Like one of the metabolites they just named is called reuteri because it's named after Lactobacillus reuteri. It makes this chemical that we absorb into our body that becomes part of the dialogue between the intestinal lining cell and the iron sensation that's actually given to the brain blood supply. There's a communication between those two that relies on certain metabolites that we cannot make. We named 8 of those chemicals. I bet there are 100 more.
Yeah. So let's start talking a little bit about your RightSleep program and what people could expect or who. I mean, obviously we know anyone who's having issues sleeping, or if they're feeling fatigue, if they're having headaches, anxiety, things like that. These days people have sleep trackers, so it's kind of pretty easy to see if you're sleeping well or not. Tell us a little bit about what you do and what you take people through in the RightSleep program.
Okay. The first important thing to know is it is a little complicated. And because of that, and because many of the ideas are not the ideas being put forth at the moment, I have a workbook. That workbook looks like this. If you print it out, it comes digitally to you. It takes you through all the general steps. It's the how to do it. It's not the science that you and I are talking about. It's, okay, having said all that, what do I do? Okay. Mm-hmm. And it gives you very specific steps. You need to get your D level done. You need to do your B12. You need to start with this. Here are the things you should look for. Here are the clinical parameters that you should be following in yourself. And it has a whole year's worth of a journal. Because what we're using, instead of me being, I'm the smart one, I have the piece of paper, I have the level. That is what medicine and most of the practitioners are doing now. Unfortunately, it's not that I don't care about the levels, it's that they didn't work. So the clinical response is what you need to measure. So there's a journal, you need to write things down. So that is part of the program. You get this workbook. The second piece is that there are Q&As every month, and you have, as you join the program, you get access to those Q&As. So there are lots of questions about B5, and these are pretty difficult concepts biochemically. Most people don't have a biochemical degree. So there's a lot of longer term learning that what we're trying to do is find, I've seen my sleep doctor or I've seen my PCP, and here are the choices they've given me. Is there any other thing? I've already done my diet. I've followed Zamir's recommendations, okay? What if my sleep is still bad? Is there anything else that I might be able to get my hands on that would help me, all right? Mm-hmm. And these are just other tools. Now, that piece is what you can do on your own. I also do individual coaching with people, and I've really tried to make the workbook be what you need to be successful for most types of sleep disorders on your own. Now, in the background, one other important piece is many of the people that I see have severe pain of various kinds. it's important to note that there is an inflammatory pathway that is called the acetylcholine anti-inflammatory pathway. If your acetylcholine levels are not right, then what you will manifest is chronic pain. You might actually get what's called mast cell activation, hives. There are many subtypes of nutritional intervention that are directed against the mast cells going crazy. The mast cells go crazy because they're being sent messages because we are not getting our acetylcholine anti-inflammatory pathway appropriately treated. And that is totally separate from what we talked about with the autonomic nervous system and with sleep. That means there's this one chemical that actually branches out to also be very important in autoimmunity and chronic pain. So what we have not only on the website, but in multiple other video deliveries on YouTube are specific, small videos about specific complaints. What if I have headaches? What if I have back pain? What if I have been told that I have mast cell activation? What if I've been told I have IBS? What if I have ulcerative colitis? So oddly enough, all of these things are related in the background to sleep and the microbiome, and ultimately to D. The reason why you're interested in this is that has been your experience. That D and the microbiome are pivotal to what you did to change your life.
Right, exactly. I have a couple other quick rapid fire questions for you, but real quick, where can people, if they're interested in going through the RightSleep program or working with you, where should they go?
Dr. Gominak, Gominak, drgominak.com. And if you just put in vitamin D and gomaflogy on YouTube, my website my YouTube site will pop up also. And that YouTube site is RightSleep. So if you put in RightSleep, that on YouTube, that's what'll pop up.
Got it. Real quick question. You mentioned a couple of times, and I'm pretty familiar with supplements, but I hadn't heard necessarily of B100, and then you said now you take B50. What type of, if people search, can you just search B100 or B50 and you'll find that? Is there a specific type you need to look for there, or what? Because I'm sure people are going to listen and they say, oh, I need to go buy some B100 or B50 right now.
Thank you for asking that. It is a B complex, but when it says B100 on the front, it is supposed to have 100 of thiamine, 100 of riboflavin, 100 of niacin. It always has a little bit more of folic acid because there are no federally dictated expectations of vitamins the way they are for drugs. We don't have a regulatory agency. Instead, we have vitamins in all forms, and you really have to educate yourself. That's what you learned. B100 means that it has all 8 vitamins and it has all 8 B vitamins. It's a form of B complex, and it has 100 milligrams or 100 micrograms. So some of the Bs like biotin, folic acid, and B12 come in micrograms. That was on the shelf where I went to buy it. And knowing nothing, that was successful in my patients in the beginning. And then what I realized was if I gave that B100 as the first recommendation along with D to a gal who just had her second baby and had a daily headache, she got all over aching and stiffness. And she would come back and say, that B100 you put me on made me ache all over and I felt old when I got up. That will sound familiar to you. It does to me. And I broke it in half. So she says, I broke it in half and now I feel fine. So what I learned was you can become profoundly B vitamin deficient. There really are stores. This idea that it's water soluble and you pee it out is incorrect. If you've been sick a longer time without your microbiome operating correctly for a longer time, in order to get the bugs to come back and to feed your body. Keep in mind, you're taking something that has to be split between the needs of your bacteria. And what you're doing is you're creating a B vitamin soup that is favoring the healthy foursome of phyla. So when you take that, you are creating this soup. If you don't take enough to fit your deficiencies, then your body sucks it all up, and the good guys don't ever come back. So in my patients and myself, we had been on D for 2 years, and I'd actually forced all of us into a B vitamin deficiency state that started to manifest with new pain. So when we took B100, for most of us in that group, it was the perfect dose. But if you stay on it for more than 3 months, the pain comes back. That means too much. So the concept in the background is, as my bacteria come back, they are the boss. They are the only experts as to how much B vitamins you were supposed to be receiving and in what ratios, hour by hour throughout the day. And they come from different parts of the GI tract. This is why poop samples are not that helpful. They come from different populations in the top of the small intestine than in the colon. In the background, that means I learned that B50 is the better place to start. So in all of the general public who doesn't have me right next to them, who doesn't really understand this concept that sicker you are, the more likely you'll be to be more profoundly B deficient. So there are instructions on how to step into this gently. But B50 is a B complex that has 50 milligrams or 50 micrograms. It is what's called non-proprietary, which means it doesn't matter what the maker's name is. If it says B50, it's supposed to have 50 of everything except for folic acid, which is slightly different. And that means that you're providing what we think will be the correct ratios to favor the growth of these 4 phyla to come back. Then once you have the natural supply, all of a sudden at the 3.5 month mark, you're going to have double the dose. And you're going to turn back into one of my patients who came back and said, were you trying to kill me? Okay. That gal who said, you know, that B100 you gave me made me ache all over. I said, oh, that's what I feel like. I thought I had the flu, but I'd had the flu for like a month. I was into the 4.5 months of taking B100. And at that point, I thought, maybe this idea that the bacteria have come back and they're providing the right dose is actually right. And that's what happened. My patients had great 3 months. Their sleep got better. Their pain went away. And then at the 4th month, everything came rushing back again. Then we have to stop it. Then it turns out there's a little bit more complex after that we're gonna have time to talk about. But your brain, after it gets really happy and it sleeps well for 3 months, it starts to ask you for more B5. And then you have to go back on the Bs again.
Interesting. And methylated, these days, I mean, it seems that you want to look for methylated B vitamins. Do you have any, or does that not matter in your opinion?
This is a really important issue. And if you don't mind, single nucleotide polymorphism is the name that the practitioners are telling us. You have a single nucleotide polymorphism, or an SNP, that says your body prefers methylated B12, methylated folate. Single nucleotide polymorphisms is a way of saying you have a normal gene, but this gene is known to come in different flavors. There's vanilla, chocolate, strawberry, and you have the strawberry flavor, okay? If a third of the population needs methylated B12 and methylated folate, where was that coming from before the supplement industry came about? Why would there be a third of the population if there was no supply? If you look into the microbiology literature, which is not where most of us go, they're writing about 20 years worth of studying all the variables about which bacteria make B12 and what are the multiple forms of B12 that are made by different subspecies of even the same lactobacillus or whatever microbiome, whatever bacteria you're studying. And it turns out that not only do we have supplies of methylated B12, we probably have multiple types of most of the B vitamins. We probably only have one type of B5 because the pump that pumps in B5 is extremely specific. And there is no B5 in any food in that form. So there's some things that have been used, these generalized statements saying, oh, we pee out the B vitamins. Oh, we don't have any stores. Oh, it comes from the food. And if you're eating a normal diet. So when medicine stepped away from responsibility for the vitamins in the 80s, what they said was, if you have a normal diet, you don't need supplement vitamins. It's possible that at that point, which was in the early 80s, most of the population had not become D deficient. We didn't come into the world with this recommendation to stay out of the sun until the middle 80s, and when sunscreen came available. That means in a population that's living outdoors their whole life, they probably don't need supplements. They have a normal microbiome. Now we've dragged those overarching statements into a time when really most of the population around the globe does not have a normal microbiome. And that is the background. That is something that I saw in my patients. The lucky thing is I'm not a GI doctor. I didn't know anything about, I knew that there were these crazy doctors in Oklahoma who were doing poop transplants. I mean, that seemed totally crazy to me. But if you're dying of C. diff in the hospital, you're going to let them do anything. Now, that means that the GI literature supports these ideas. In fact, the first article that actually showed that D is a necessary cofactor to have a normal microbiome was in 2020 during COVID. So I had this idea because what Walter Stumpf had written, that the D should be one of the cofactors necessary. That's why I was thinking when I gave D for 2 years that it should cure the IBS, but it does not. You must give it the other 8 chemicals that it needs, and then it gets back to normal. Now, there's one other really important piece of that, which is the parasympathetic and the sympathetic nervous system are what runs the nervous system of the belly. That means when my patients stopped the B50 at 3 months, and they did well for 3 months, and then they started to have belly cramping and gas and bloating, it wasn't because their bugs had gone back to being the wrong bugs. It was because the nervous system of the GI tract was cranky again. And if you don't get the acetylcholine right, then you revert back to either constipation or diarrhea or bloating, whatever your IBS complaints were before. So that's a pretty complicated issue. That's why I have a website. All of the information on the website is free. The thing that costs you, because what I've learned is if you pay $100 to join a program, you're much more likely to actually follow it all the way through and see success.
That's right. That's absolutely right. Well, Dr. Gominak, thank you so much. This has been really eye-opening. You certainly know the science behind all of this. And I think people who are having sleep issues and fatigue and other issues, pain and rheumatoid arthritis, all sorts of issues like that, I think could really benefit a lot. So yeah, the website again is drgominak, drgominak.com. Highly recommend everyone go there, check out the free resources, and pursue her, paid programs if you're interested as well. I'm a big believer in having a coach, and like you said, investing a little bit of your money to really be invested in it and get the results. And I really thank you for all the science and everything that you're doing. And this was an absolute pleasure. Thank you so much for joining us today.
Thanks to Laura. It was a pleasure talking to you. You have a great website also. You're doing really good work.
Thank you so much. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. peakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.